There's one other issue I would like to talk to you about before you go, John, and that is whether you would allow me to discuss the results of your test with your GP.
To be honest, Doctor, I don't really know my GP.
Okay, it's just important for your own welfare.
The thing is, she also looks after my wife and the rest of my family, so I would really rather she does not know. I don't think she would treat me the same.
Again, I understand your situation, but I do think that you may need to tell your GP at some point. The therapies that we may put you onto eventually manage your condition. Although they are safe, they do have a lot of interactions with other drugs, and there are always side effects. It would be better for your sake if you told her, so that if you did get a side effect and you are unsure about it, or confused with something else, she would have enough background knowledge to be able to deal with the situation.
Doctor, do you not think it's enough that I have to tell my wife? I don't want everyone knowing. I just want to be treated like everyone else.
John, I understand that this is a lot to take in right now, but again, I think you should have more time to think about it.
Would that really be okay?
Of course. Look, there is no urgency to tell your GP, and I feel that if they undertake the appropriate safety precautions, then they should be at no increased risk of contracting HIV from you. So, I won't break your confidentiality in this particular situation.
I guess this is some good news at least.
However, John, I would urge you to consider this. GPs play a vital role in management of most chronic medical conditions, including HIV. In addition, they are, like me, bound by the same clauses and follow regulations set out by our governing body, the GMC, to not disclose your information to outside parties and retain our patients' confidentiality.
I guess if you need to tell my wife, they would as well.
Yes. Again, they will be duty-bound like I am, in that if they believe you pose a serious risk to other individuals, they will need to say something.
I see. Well, thank you for giving me time to think about it. I just wish it didn't have to be the same GP as the rest of my family.
Well, like I said, there should be no risk of her breaking your confidentiality, but if you feel you don't like the idea of it, then maybe you can request a different GP, or enlist in a different practice, and that way there wouldn't be those concerns.
Well, maybe that's not such a bad idea.